Today we will be discussing the glioblastoma multiforme, which is the primary brain tumor. It is also called a astrocytoma. So this is the most common primary malignant central nervous system tumor in adults. This is a malignant tumor. It is high-grade tumor of glial cells, which are called astrocytes. It has a poor prognosis. The glioblastoma multiforme is a butterfly-shaped lesion. That is, it is raised in the cerebral hemisphere and crosses the corpus callosum. Over here, you can see that it is a butterfly-shaped tumor, and it crosses the cerebral hemisphere. This is one cerebral hemisphere. This is the another cerebral hemisphere, and this tumor can cross the cerebral hemisphere, and it is butterfly-shaped. There are regions of necrosis which are surrounded by the tumor cells, and the tumor cells in the case of glioblastoma multiforme is astrocytes, which is one of the type of glial cells, and there are pseudopenicating. These astrocytes, these tumor cells are pseudopenicating. They are also surrounded by the endothelial cells proliferation. Over here, you can see that this is the area of the necrosis, and it is surrounded by the astrocytes, which are the tumor cells over here. And these tumor cells are arranged in a patient, which is called pseudopericytic, that is fencing around the necrosis. It is also surrounded by the endothelial cells, which has been proliferated over there. It is not shown over here, but you should remember that endothelial cells are also proliferated in the case of glioblastoma multiforme or astrocytoma. This is a histology slide of the glioblastoma multiforme. This is over here. You can see that this is the necrosis, and this is the pseudopericytic formed by the tumor cells, which are astrocytes. We can draw. Okay. This is necrosis, necrotic lesion, and over here you can see that these are the astrocytes and forming the fencing around the necrotic lesion or necrotic area. This is the necrotic area, and these are the astrocytes, which are pseudopericytic. Okay. Glioblastoma multiforme are these are the tumors which are GFAP positive tumor. The GFAP are astrocyte markers, and these are positive in the glial tumors and in the glioblastoma multiforme. The GFAP are type of intermediate pyramids. So that's all for the glioblastoma multiforme or astrocytoma. Hope you would have understand. If you have any query, you can ask in the comment section. Stay tuned with us for more videos. Thank you.